Tomorrow, New Jersey will roll out its updated pandemic flu plan. This version, number 4, is much different than earlier versions. It's an operational plan that provides a framework for how the state would ramp up a response to an avian or bird flu pandemic. NJN News health and medical correspondent Sarah Lee Kessler has a preview.
New Jersey, led by state epidemiologist Eddie Bresnitz, has been planning for pandemic flu for 9 years, urging the rest of us to prepare too. Along the way, the health department has released 3 plans. Here's number 4. It may still be labeled draft, but Dr. Bresnitz says it's a real operational plan.
If we had a flu pandemic or an imminent one, we could take this off the shelf and really follow the lead here. Whereas the
plan focuses on 10 distinct areas, including
surveillance, laboratory diagnostics, clinical guidelines, use of antiviral agents, use of vaccines, distribution of those biologicals. It's a roadmap or blueprint for ramping up, first to prepare and then to respond to a pandemic.
Dr. Bresnitz says any response would depend on the severity of the outbreak.
Sort of the light part of the graph, things are okay. As you move into the darker part, it becomes a dark period in civilization.
Do you still feel that it's not a question of if, it's a question of when, a pandemic?
I do. I mean, there's no reason for us to change our opinion of that.
Until now, scientists and cartoonists have focused most of their attention on H5N1, a bird flu virus class that has a death rate of 63%. Experts all agree that if pandemic flu does strike, the healthcare system will have to take a battlefield approach to handling what will be a mass casualty crisis. A recent article in the medical journal Chest said doctors will have to make godlike decisions about which patients will get scarce resources like ventilators.
People would need courage, basically, to make those kinds of decisions.
Sarah Lee Kessler, NJN News, Trenton.